Statement of fact number 15. There is no evidence that any of the extensive and expensive laboratory data obtained on the patients were used for treatment decisions. Once again, the medical board is making statements that are absolutely false and erroneous. I don't know whether people realize this, but these types of statements, in our country, the law of the land is innocent until proven guilty. Yet these statements that came out in the original charges already made me guilty. They already said that I was guilty without any hearing, without any judicious process, without any rule of law. And it was the reason they could get away with it is because the attorneys, these medical board attorneys that give the reputation to attorneys that is not justified for most attorneys, but used car salesmen and no offense to used car salesmen because I don't want to put you in the same category as the North Carolina Medical Board attorneys, but it's the reputation that, the bad reputation that attorneys get because of these medical board attorneys and because of their actions, because of their unethical actions. These liars know the facts, they've reviewed the cases, they've had the charge for 2 years, and they still end up making these type of statements. The poor medical board president, which is no excuse, she has the power of the pen behind her, she should be able to read these things, but they prepare these documents and have her sign it. Why? Because a prosecutor that makes these kind of statements would be subject to ramifications by the Bar Association. A prosecutor cannot make statements like that that presume a person to be guilty. The medical board gets away with it. Why? Because they prepare, the attorneys prepare the documents, but they have the medical board president. They have a doctor sign it, and the doctor doesn't know any better, and the attorneys are protected now because they didn't sign the document. They prepared it, but they didn't sign it. This is, I mean, even scumbags don't do this kind of stuff. And these attorneys are in the job of trying to make sure that they have enough kill rate. They need to have enough prosecutions to be high up enough in a thing called the Nader score and the Nader ranking. And the North Carolina Medical Board had, when they started to bring these attorneys on to recruit attorneys to be prosecutors of the medical board, their criteria was who would have which attorney would be aggressive enough and prosecute enough in order to have the North Carolina Medical Board's Nader rankings highest. The Nader ranking, the more prosecutions you have, the more supposedly better medical board that you have. The only problem is the medical board is running out of people to go after. So what do? They go after anybody that's different. So if you're of a different skin color, it's no different than going after somebody with a different philosophy, different testing methodology. And doctors doing integrative medicine are ripe. They are ripe for to have the target drawn around their chest and have the medical boards come after us. If you look at the number of integrative doctors compared to the number of conventional doctors that are being scrutinized, the integrative doctors in North Carolina, 16% of integrative doctors are being scrutinized versus less than 1% of the regular medical community. Despite the fact that integrative doctors don't hurt patients. Patients don't get hurt by integrative physicians. They get hurt by the conventional doctors. Why is it that in North Carolina we have multiple cases of doctors that have committed malpractice to the point of having $500,000 or more paid out because of the negligence, and patients have even died because of the result of this negligence, and the medical board has not acted, not even with an informal slap on the wrist, nothing, because they're part of the good old boy network. That's why. And there's a lot more of this that's going to be exposed in the coming months. Again, finding of fact number 15, according to the medical board attorneys, there's no evidence that any of the extensive and expensive laboratory data obtained on the patients were used for treatment decisions. Every one of those lab tests that were done were to determine whether the patient could handle more treatment, whether the patient's kidneys were able to handle what was going on, the liver, the response, being able to document the objective improvement of the patient, seeing their liver functions going from something that's considered to be extremely, extremely bad and impossible to reverse, and us documenting in 3, 4, 5 days how the liver functions have improved. This has all been documented. It's all been shown how we were able to actually improve liver function and kidney function, which these doctors, doctors that are judging me, don't even understand that that's even possible, and yet we've got it documented. So now they're going to start saying that these objective measurements of improvement and these test parameters that we use to adjust our treatment protocols, they don't understand what we were doing, they don't get it, and so based upon the fact that they're not bright enough to understand what's going on, that these tests were expensive and were used for no decision making in the treatment process. Again, an absolute ludicrous, blatant lie that anybody with 2 brain cells could look at the chart and see the facts for themselves. And again, don't trust me. Read the stuff yourself or look at the 9 other experts that reviewed these charts and see what they say.